So welcome back. Today we will be covering pregnancy and autoimmune rheumatological diseases. But before we get into that, it is important for you to understand what happens in the body normally. So if you haven't done so already, I would highly suggest that you look at the videos basics part 1 and 2 in the medicine series just to kind of understand the layout of the body and to realize what it does and why it does it and how it does it. So let us begin. When it comes to circulation or blood flow on the inside of the body in a non-pregnant female patient, it's something like this. The blood is collected in the venous system in the body and it passes by the liver. And the liver will then put in nutrients that it has already processed from the gut and hopefully anything that it has detoxified as well. It then goes to the heart, and the heart will then pump this blood to the lungs. The lungs will get rid of the carbon dioxide that is built up in the blood that is very toxic to the human body, and it will put in oxygen instead, which the body needs to survive. That blood then goes back to the heart, and it is pumped out to the rest of the body. As it is pumped out to the rest of the body, about 20% of it, or about a fifth of it, will go through the kidneys in what is called a parallel circulation. And this is where the kidneys will keep doing their thing while the blood still travels to the rest of the body. And the kidneys will filter the blood, but they will also perfectly balance the blood, which is what the body needs to survive. It's called homeostasis. Now, one of the organs that the blood will go to in the rest of the body in the female is called the uterus. And the uterus looks like a deflated balloon. It kind of sits like this with the opening down. It's made of muscle and it's right behind the bladder, but it's way below the intestines, so it's in the lower pelvic cavity, and it's about the size of a fist. After all the organs use the blood, including the uterus, the blood then goes back to the venous system. It goes back by the liver, back into the heart, and the whole process repeats again. Now, this happens about 80 times a minute. So as a result, the kidneys are filtering all the blood in the body every 5 minutes, or about 300 times a day, which is pretty amazing. Now, if we look at the circulation of the blood in a pregnant body, it's a little bit different. And it's different because of the baby. Now, the baby will grow in the uterus. So the uterus is down here, and the baby grows, and the uterus will expand as the baby grows more. And the baby is attached to the uterus on the inside through this thing called the placenta. It's like a patch on the inside of our balloon, if you will. And that placenta is very complex. It acts like a filter. It's made up of a lot of blood vessels, and we will get into this more later. The placenta is connected to the baby through this rope of blood vessels that is called the umbilical cord. So now the circulation in a pregnant body looks like this. The blood is collected from the venous system. It passes by the liver where it has nutrients put into it. It goes to the heart, it's pumped to the lungs where it picks up oxygen, and then it goes back to the heart and it goes to the rest of the body, the kidneys in this parallel circulation. The kidneys will clean and filter the blood and perfectly balance it. It will go to the rest of the body, including the uterus, and then it will go through that placenta and through the umbilical cord to the baby. The baby will use up that oxygen, the nutrients, and the blood is now perfectly balanced. It will return the rest of the blood, and once it is used, back to the placenta, and the placenta will then send it to the uterus, and then from the uterus, it goes back into the venous system and back by mom's liver, mom's heart, mom's lungs, mom's heart again, mom's kidney again, mom's uterus again, back to the placenta, the umbilical cord baby, umbilical cord, back to the placenta, back to mom's uterus, and mom's blood again, mom's body again. So as you can see, mom's body is really being overworked just in a regular pregnancy, especially the liver, the heart, the lungs, and the kidneys. But the way this is set up also benefits the baby quite a bit because now the baby is getting blood that's very high in nutrients, very high in oxygen, and is also filtered and perfectly balanced. So when it comes to autoimmune rheumatological diseases and pregnancy, the disease itself is overworking the body. And guess what it's overworking the most? The liver, the heart, the lungs, and the kidney. And not just the disease, but also the treatments that we rheumatologists use to control it. And in fact, the goal of rheumatologists in their pregnant patients is to make sure that the mom's body is not overworked too much, and to hopefully make sure that the pregnancy and the delivery is safe for both mom and baby. And there is a reason for this, because rheumatological patients have a decreased fertility but a higher risk in pregnancy and delivery. What does this mean? It means that our patients can sometimes have a harder time getting pregnant, but they will definitely have a higher risk in pregnancy and delivery itself. Now, to give you an idea of this risk, if I take 100 regular pregnant patients and put them in a room, about 10 of them may have some complications. However, if I take 100 diabetic pregnant patients and put them in a room, that risk doubles. Now about 20 may have complications. If I change that to 100 rheumatological patients and put them in a room, that risk doubles even more. So now it's almost 40 of those patients will have complications. And that risk, that poor outcome, can definitely be decreased or can be definitely lowered depending on how well the disease is controlled and how well this pregnancy is planned before pregnancy, during pregnancy, and after pregnancy for both mom and baby, like different monitoring, etc. So actually, we are going to stop here today because I know it's a lot of new words, it's a lot of new ideas. But hopefully, by understanding or truly understanding what we have learned today, will make it easier for you to make sense of what is to come, at least from a rheumatological standpoint. As the famous Greek philosopher Aristotle said, patience is bitter, but its fruit is sweet. Until next time.